hear this message, wherever you stand, I'm calling every woman, I'm calling every man. We're the generation, can't afford to wait. The future started yesterday, and we're already late. We've been looking for a song to sing, search for a melody, search for someone to lead. We've been looking for the world to change. If you feel the same, then go on and say, if you're out there, sing along with me. If you're out there, I'm dying to believe that you're out there. Stand up and sing it loud if you're out there. Tomorrow starting now. No more broken promises, no more calls to war, unless it's love and peace that we're really fighting for. We can destroy hunger, we can conquer hate. Put down the arms and raise your voice, we're joining hands today. I've been looking for a song to sing, search for a leader, but the leader was me. We've been looking for the world to change. We can be heroes, just go on and say, if you're out there, sing along with me. If you're out there, I'm dying to believe that you're out there. Stand up and sing it loud if you're out there. Tomorrow starting now. Wherever you stand, I'm calling every woman, I'm calling every man. We're the generation, can't afford to wait. The future started yesterday, we're already late. Thank you.
Before I hand it over to Representative Craig, I'd like to lay out some ground rules for the event this afternoon. In order to keep the town hall respectful and make sure that we have time to take as many questions as possible, we will be keeping the following ground rules. This town has Minnesota rules and elementary school classroom rules, which means we will treat one another with respect. Tough questions are great and are welcomed. Obscenity is not allowed and will keep each person from enjoying the town hall. Each person will have 1 minute to ask one question. Everyone gets to ask one question before anyone gets to ask a second question. If you would like to ask another question, you are free to get back in line at the end of the event. If you have not asked a question by the time 1 minute rolls around, a bell will ring out to let you know that you are over time, and I will probably politely interrupt you. Angie and our panelists' responses to each question will be limited to 2 minutes so that we can get to as many questions as possible. If they go over 2 minutes, they will also be prompted to end their comments with a bell and a kind interruption from me. This town hall will have 2 parts. During the first part, Angie and our panel will answer questions about bringing down the cost of healthcare. If you have a question about a topic other than healthcare, please wait to ask it until the second part of the town hall, when Angie will do a free question and answer period. So, with that, I'll hand it off to Representative Craig to make an opening statement and introduce our panelists.
Thank you so much, Kate. Hello? Okay, yeah, all right. Thank you so much, Kate. I really appreciate you being here as well, and I cannot thank Russo enough for that just amazing, amazing performance. I always ask at the beginning of my opening remarks if any veterans in the room could stand. If you have raise your hand if you're a veteran. Thank you so much. Since I've been a member of Congress, I've also made it part of this process to stand and together say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you so much. I just want to make a few opening remarks here today, and then I'd like the opportunity to introduce my panelists. Before I do that, though, I want to recognize some dignitaries who are in the room, if I can call you that. The first is Senator Greg Clausen, who represents this part of the his amazing wife, Bobby, is sitting there. And then Representative Sandy Mason, who represents 51A, and she is my state representative. So if I have an issue at the state level, I call Sandy. And I want to also introduce Representative John. What's your name, John? Representative John Hewitt, who represents, I don't know your actual number. What is that? 57B. Well, we can test the equipment out here on you today, so thanks for that. But yeah, so Rosemount is where my youngest son goes to high school, so thank you for representing that area of the congressional district. Everywhere I go, the number one issue that constituents, no matter where they are ideologically, talk to me about is the cost of health care and the price of prescription drugs. And it's not just folks who are in the individual marketplace, but of course that is an important constituency who talks to me about this, but it's almost every conversation that I'm in. I didn't appreciate even when I was appointed to the Transportation and Infrastructure Committee just how much time I would be spending talking about the need for investment in rural broadband so that we could deliver rural health care throughout our communities. And I didn't appreciate when I was appointed to the Ag Committee just how much time I was going to be spending talking to family farmers whose perhaps number one issue is markets that they can sell their products into and trade, but a very, very close second is the price of their health care. So as we enter into this discussion and dialogue today, one of the amazing things about meeting with folks in the district and in our town hall forums is that we get to have a conversation about what's top on your mind, but that format really doesn't allow us to dig into the policy solutions that could actually help us solve these issues. And I will tell you, one of the most disappointing parts of serving in this Congress is how political healthcare has become. How political it's become. Because no matter where you are in terms of solving today's healthcare challenges, we all agree that there are healthcare challenges. And I believe that the solution should not be a political solution, but that they should be policy solutions, and that the law, the ACA, that right now the DOJ is down in Texas versus the U.S., trying to argue the entirety of the law is unconstitutional and should be thrown out, actually put forward a number of improvements. But as I talk to my colleagues across the aisle, we agree on some policy things, but the problem is if we actually work together to stabilize the healthcare system that we have today, the political parties aren't happy. So it is a conundrum, and my hope today is that we've got some folks here with direct experience, and all of you who have direct experience in the rising cost of healthcare that can help us come up with some policy solutions. As I think about this issue, though, I think about these stories first and foremost. A farmer family who pays $24,000 a year in the individual marketplace today with a deductible of $12,000. I think about a woman whose husband became very ill and is contemplating divorce because she doesn't want to be left with bankruptcy at the end of his illness. I think about Alex Smith, the 26-year-old young man in Minnesota who was rationing his insulin and is no longer with us. I think about these stories most when I think about this topic. Now, the question isn't whether we need to do something that will get us to universal health care, where every single American has health care that they can afford. The question is how we get there, in my mind. And there are a number of very good policy solutions that I'd like for us to consider. So that's what we're doing here today. That's what I brought you here to talk about. And then we're going to have a second portion of the agenda, and you can ask any question that is on your mind as well. So to start us off, though, I just want to say thank you to my three panelists here this afternoon. Dr. Lauren Williams is a family medicine specialist. Lauren did her residency at the University of Minnesota, North Memorial Hospital, and she was named 2018 Family Medicine Resident of the Year by the Minnesota Academy of Family Physicians. So Lauren, thank you so much for being with us here today. I also want to introduce Dr. Dory Cross. She's a PhD Assistant Professor of Health Policy and Management at the University of Minnesota School of Public Health. Thank you so much for being here today. And, last but certainly not at all least, I want to say thank you so much to Andy Slavitt for agreeing to make time to sit on this panel here this afternoon. Andy is board chair of the United States of Care, which is a national nonprofit healthcare think tank and advocacy organization that he founded to try to get us to access to healthcare for all Americans in this country. Now, there are other titles that they hold and have, but rather than further introducing them, I'd love to ask each of them to tell you a little bit more about themselves and the work that they've been doing, and then I'll start off the questions, but get your healthcare questions ready.
Hi everyone, is this working?
Yep.
I'm delighted to be here, thank you so much. I'd like to start and just give a little bit more kind of context and background into the type of research that I do and what motivates the things that I study in healthcare. And I think like everyone in the room, I'm interested in how see see personally and see in the lives of our family members and our friends. And when I think about kind of what drives the increase in costs, we have a big price issue, and we also have issues in how we use healthcare. And I'm thinking about how we improve healthcare quality as a way to drive improvement in quality and improvement in cost. And so, you know, when I think about a patient who's in the hospital 3, 4, 5 times in the past year, I think about how expensive that hospital stay is. And that's an issue, it's a very complex issue that has to do with a lot of factors. But I also think about why was that patient in the hospital 5 times in the past year? And is there something that we could do differently, do better to prevent those hospitalizations? We spend more time, more money on the front end, be more efficient with our time and resources to drive improved quality, which leads to system level cost savings that then translate down to what the consumer feels in terms of everyday healthcare costs and premiums. So I'm excited to talk more about that. My focus is really, again, on healthcare delivery and how do we improve the quality of, healthcare delivery and how that translates to savings. Thank you.
Great, so my name is Lauren Williams, and I'm a family physician. I currently practice in the North Metro, and I'm really grateful to be here today with all of you. As a family physician, my first priority every day is the patient that's sitting in front of me in my clinic. I get the privilege to see sometimes up to 20 or 30 patients in a day. Those are the rough ones, but in my practice, and I get to discuss with people what their lives are like, what things they're dealing with, what health challenges they're facing, what stressors at home they're facing that affect their health. And I so enjoy getting to connect with people and brainstorm and try to figure out ways to address the health issues that they're facing. But I recognize that so little of the entire outcome of their health care is just those 15 or 20 minutes that we get to spend in clinic together, that there are so many broader systems issues and concerns with the healthcare system and the way that communities are organized, even to that affect how that patient's health actually will be in the coming months to years. And so I really have tried to engage with policy on both a local and national level to try to help both with prevention of medical problems and also with addressing medical problems efficiently and excellently. And so I think that those are two of the solutions that I most see as ways to limit the cost of healthcare and as well as improve the quality of people's lives, because ultimately we can cut costs or increase costs as much as we want, but it's all about you all and living the best, most healthy lives that you can, and we want to do that well and efficiently. And so I think that both looking at things from a preventative care standpoint as well as addressing the problems that do arise efficiently, which means prompt access to care and allowing you to get the best care that you need, including the medications that are first-line treatments for whatever issues arise without cost limitations to that. So I'm really looking forward to discussing that more with you all. Thanks.
Good afternoon. And thank you for having me here, Representative Craig. And thank you also for putting the word represent back in representative.
Yes.
For too long, this district and others like it were served by people who I think felt they were serving their party, not their constituents. And you being here alone and having this conversation just is an enormous step forward in our representative democracy. I had the pleasure of serving for a few years in the Obama administration, and after I left, I spent the next year doing town halls around the country, in every kind of district you can imagine, suburbs of Ohio and Alaska, military bases in Arizona, red, purple districts, any kind of district you want. And all people really wanted is to know that the issues that mattered in their lives, issues like healthcare, were not going to be decided by politicians without their voice. And I think we're a step closer to bringing that back. There's a real commonality when you talk to Americans, and it doesn't matter which political party they support, it doesn't matter whether they like President Obama or didn't, whether they like President Trump or didn't like President Trump. They believe they should be able to afford to take care of their families if someone gets sick. And they don't believe that's too much to ask. And they think there's factors out of their control, whether it's a court case, a Congress, a president, an insurance company, that's getting in their way. And today, unfortunately, most Americans believe that if someone in their family were to get sick, they're not quite sure whether they would be able to pay the bills. Because so many Americans live the cost of an emergency room away from bankruptcy today. And those expenses are harder and harder for ordinary people to address and to control. I had a conversation with the head of the American Cancer Society. They have a hotline for people who are newly diagnosed with cancer. And he told me that the number one call they receive is the call that says, I can't afford to have cancer. That's the number one call they receive. And indeed, within 2 years of a cancer diagnosis, 40% of people with diagnosed with cancer have spent through their life savings. 1 in 4 Americans goes to the pharmacy to pick up a prescription and walks out without that prescription due to cost. Today. That's not a crisis of the future, that's a crisis of today. So, we have made progress in the last decade, but we haven't made enough. And I think what you're going to see is that, as in 2018, the reason healthcare became such an important issue, the reason Representative Craig gets asked about healthcare all the time, is because it's not just about our health, but it's about our ability to stay in the middle class. It's about our ability to take care of ourselves, and it's an enormous pocketbook issue. Far more important than whatever happens to our tax rate is these large deductibles, these unaffordable expenses that Representative Craig referred to. And so increasingly you've got a divide, and I'm going to talk for a second, if you'll allow, just about what I think you'll see in the presidential election and some of the dialogue in the country. The Democratic candidates, to a person, believe that every single person in this country should have access to affordable care, should be able to take care of their families. They'll have a big debate about how, and there are indeed just differences and distinctions. The primaries are about calling out those distinctions, talking about how, figuring out what the best path forward is. And that should be a healthy debate. Nobody should be afraid of that debate. But when it comes time to the general election, what you'll see is a contrast, or whoever represents the Democratic Party, versus the record of the president, which really is a record of 3 things. First is an ongoing effort to try to repeal every single word of the Affordable Care Act, which means protections for pre-existing conditions, lifetime caps and limits, requirements that insurance companies cover prescription drugs, requirements that people under 26 be allowed to stay on their parents' plan. The president wants to get rid of all of that, and he's currently using the courts to do that. Second is to allow, his goal to allow insurance company fine print to decide what access to health care you get. And unless you think you're better at reading the fine print than the person who wrote it is at writing it, that is a tough world to live in. We lived in that world until 2009. I have not talked to anybody who wants to go back. 80% of Americans want these protections to remain. Trump has put forward all kinds of new plans that would allow insurance companies to do that. And third is a vision of whether or not pharmaceutical companies can charge whatever they want for the prescription drugs we buy. The reason people are making a big deal now and calling attention to insulin is because for most of us, our body manufactures it. For those of us who are unlucky enough that it doesn't, you can buy insulin. It costs about less than $15 a vial to create insulin, and you can buy it for about $40 in Canada. If you want to buy it here, it costs you $240. Because here, prescription drug companies can charge whatever it is that they want. So, lots of complex issues, lots of interesting conversations about how to do things. But the point remains that we need strong representatives who are focusing on how to make healthcare more affordable every day, like Representative Craig has been doing. In my time in Washington, the reputation that you've earned for that has just been unbelievable. And then to make sure we think about all the things that account for our health. I see a Moms Demand Action t-shirt up there. Our safety in our homes, vaping with kids, all of these things that affect health are just going to be so important, and we can't get to them unless we clear up these basic differences that Americans want us to stop fighting about and start governing on.
Okay, I think, thank you. All right, now we're gonna go to the accountability portion where, Sarah, I think you're gonna hold us accountable, is that correct? Okay, good, and I'm the one who always gets deemed first, just to be clear, so I'm gonna make every effort not to do that here this afternoon. I'm gonna ask the first question, and then, if any of you have questions, where's the mic? Are we doing roving mics? Great, okay, if you have a question, we'll come to you next. So, let's all try to stay within, 1 to 2 minutes of an answer here, so we can get to plenty of questions. The first question I have is more general for the panel here. What is missing from the national conversation about lowering the cost of health care right now? What's missing from that conversation? What are we not talking about enough? Anybody got an answer? I could start if you wanted to.
Sure. Thank you. So, what is missing from the discussion? I think there are probably a lot of different components, but the first thing that comes to my mind is actually some conversations that I've been lucky enough to be a part of as part of my work with the Minnesota Academy of Family Physicians regarding the concept of primary care spend. And what this refers to is the amount of our healthcare dollars that are going into primary care. That includes family medicine. I'm a little biased, obviously, in thinking that that's important, but internal medicine, OB/GYN, care that aims at keeping patients healthy, keeping the population healthy, keeping communities healthy, and addressing issues when they do arise promptly in the most simple and appropriate manner that we can. And so trying to keep people in their homes, out of the hospital, getting the medications that they need. And right now, the way that our healthcare system is structured in a fee-for-service model, it rewards doing things. It rewards procedures and interventions and hospital stays and emergency room visits much more than it rewards clinic visits and time that I spend with someone counseling them on smoking cessation. That can easily be a 20-minute conversation that can drastically alter the health outcomes for someone for the rest of their lives. But we don't know how to reimburse for that. And so there's a lot of effort right now with the Minnesota Academy of Family Physicians and the American Academy of Family Physicians throughout the country, trying to look at how do we focus more on primary care, how do we encourage health systems and government to really use primary care more effectively.
So something that I think is in the conversation a little bit, but needs to be in the conversation more is not just improving transparency around prices and variation in prices and how much things cost, but usability of that information at the point of care. So when we look at wild differences in payment rates and how differently you can pay for a hospital stay for two hospitals that are across the street from each other, or if you're in the office with your primary care physician and you're trying to make a decision about a course of treatment and there are real cost differences across those treatments, having that information that's available and usable at the point of care for patients and their providers, I think is really important and is not really being considered as much. Just taking, price masters and posting them on the internet somewhere is not meaningful in terms of how we make healthcare decisions as consumers and as providers. And I'd like to see more conversation around that, because I think if we want consumers to feel empowered and we want providers to feel capable of making good decisions alongside their patients, we need to give them better tools to do so.
So right now, we are the only major country in the world with this declining life expectancy. Over the last decade, we've lost 1 million fellow Americans to what we call diseases of despair. That is suicide, drug addiction, and alcoholism. 1 million in the last decade. Over the next decade, we are on track to lose 2 million more Americans to those 3 causes. We have such a vast underinvestment in our mental health infrastructure in this country for a lot of reasons. But the good news is that a couple decades ago, we faced the crisis with HIV/AIDS, and Congress put $25 billion to the Ryan White Foundation, and we kicked it, we beat it. We discovered cures. We need to be making some reinvestments in our own healthcare and the quality of our lives. And the way to do that is we need to make some tough decisions. We should allow pharmaceutical companies to make a profit when they create a drug that saves our lives or makes us feel better or makes friends, but they don't need to make as much money as we make. We don't need Medicare Advantage plans to make $25 billion a year in profit. They can do fine with a little less than that. So we need to make some tough choices, and we need to turn around and reinvest that in the things that we know are going to keep us healthy. The country, we spoke about primary care and so forth, but if we ignore really the mental health crisis in our country, it's just going to continue to get worse and worse.
So much, Andy. I was just in a freshman working group on the opioid crisis on Thursday morning before I came back for the weekend. Freshman David Trum was leading this, and I couldn't agree with your comments more. It's something that we've got to tackle from a medical therapy perspective. If we are going to actually keep people in recovery from addiction, we're going to need an infrastructure to be able to do that as well. I made a note just of 5 quick things from my own question. I don't have enough time to talk about each of them, but so if you have a question, please ask a little more. But as Lauren said, it's this idea of primary care physicians and prevention. And how do we have a better understanding of social determinants of health across this country? And I visited the NIH last Monday for about 4.5 hours, and one of the largest studies in the history of the country is underway right now that will help us generate data on social determinants of health so that we can take a more holistic point of view. I couldn't agree with you more on this topic of pharmaceutical drugs and especially biologics. The idea that the United States has a 12-year market exclusivity for biologics and many other countries have 5 years or 8 years is problematic. And then if you look at the extension of intellectual property in our country, a pharmaceutical company can change the color of a pill, can change something slightly about it, and then be able to market that drug exclusively as well. So we have got to build more pathways for generic competition in this country if we truly want to drive down the cost of prescription drugs and biologics. And then the comment around the fee-for-service pay system that we have in this nation could not be more true. We have an opportunity here to take a look at how we pay for more outcomes or value-based healthcare in this nation. And until we truly do that, I think we're going to continue to see volume-based prescribing, which is incredibly problematic. And then I'm just going to add a last thing. We have got to reform our broken campaign finance system. because until we have the special interests out of our healthcare system, and we're making policy decisions based on good policy and not on lobbyists who are lined up outside the halls of Congress, frankly, 2/3 of them who are former members of Congress, you are never going to be able to achieve the kind of reform that we need to in this nation.
All right, if anyone has a question, you can line up behind the microphone over there on the stairs.
I want it for loud.
It would be easiest for everyone else to hear if we could. And the best way to start your question is, my question is. Go ahead.
My question is someone with respect to the fact that, you know, we have a,
It's on.
my question is in regard to the fact that we have sort of federal transportation infrastructure that, you know, we've all been accused to, that, you know, if we could understand essentially what is the, you know, federal and state healthcare infrastructure and how that really ought to be able to work better, a little more seamless like we do with our transportation structure. If that was a question.
Anybody want to start? I can go first.
Yeah. So it's a great question. Our healthcare infrastructure was largely designed around hospitals and doctor's offices. It was designed around people getting acutely ill and then either being able to survive or not survive that illness. That's not what healthcare looks like in America today. What healthcare looks like today is chronic illness. And it's not because we don't, you know, a lot of people talk about chronic illness as about a country that doesn't take care of itself. It's actually about a country that's learned how to survive illnesses and turn things that used to kill us into things we can live with. Cancer today, for many people, is a chronic illness, and many of them are. So as we survive our chronic illnesses, the infrastructure that we built, hospitals, doctors' offices, aren't the appropriate infrastructure. Helping us live longer and manage our chronic illnesses, live in communities, stay at home, be comfortable, be in comfortable settings, is about a much more of a care coordination, chronic disease management system with fewer of the big giant buildings for when people we would need in the past, to a different kind of system that we need today, mental health and so on and so forth. So this is a kind of rethinking of our healthcare system that I think we can expect and should expect our elected lawmakers to help us with.
I'd just add to that, Andy, that as we think about what kinds of infrastructure we need to support that system, you're talking about the fact that in many of the rural areas in my congressional district, and even some parts of Lakeville, still don't have access to high-speed internet, if you can believe that. And if we're thinking about a healthcare system in the future where telemedicine, where the ability to conduct mental health checks, you know, from with a family, with a physician on the internet, it's critical, and we have to be able to invest in the infrastructure around our healthcare system. The other thing that I would say is, as Andy said, as chronic diseases tend to take on the high cost of healthcare, that care coordination that we're talking about, Dr. Cross, that ability to work across to keep people out of the hospital and out of acute situations, we have to rethink our payment system in the U.S. and make sure that it rewards keeping people out of the hospital, not just treating them every time they show up at the ER.
Just one other quick thing to add, when I think about healthcare infrastructure, I also think about information systems and information technology, and we've invested a lot of money in health information technology, but those systems still, we have a lot of trouble still with systems not talking to each other and being interoperable. And so as a patient moves across different healthcare settings and are engaging with more members of healthcare teams, that information isn't following them seamlessly the way it needs to. And continue investing in that infrastructure so that information is moving and following the patient, and we're not putting the burden on patients to be the one to call each provider they have and ask for printed documentation and carry it in a folder with them from point A to point B, but that we build systems that support patients as they move across the healthcare system.
Thank you. We'll take the next question.
Hi. I have a question and then an example here. Why isn't the cost of healthcare regulated, and why isn't there a watchdog group? And I have an example here. My wife's employer pays $600 a month for us, and there's $300 for her and $300 for him. That's $1,200 a month times 12. That's the year, $14,400. Then you have our high deductibles. That's another $5,400 total, $19,800 a year, just to have the coverage. That's before you walk in the door. Then on top of that, there's a 10% that you owe up to $6,000. You never get ahead. You wonder why people are getting broke. I had to pay $358 for a CPAP mask that I can buy online for $110. Didn't know that the cost was hit, even though I asked them. So what's going on? They wouldn't tell me the cost until the second of the bill.
Yep.
What's going on? A huge issue.
Sure. You know, I think the place I want to focus is on the last comment that Representative Craig made about special interests. There have been efforts, there have been bills put forward to help limit the cost of healthcare, to make it a requirement for CPAP machines, for example, that everybody that offers one has a competitive bidding process so that they outbid each other to create the lowest price. And I can tell you from my 2 years in Washington that every time something comes forward that helps people pay for healthcare, but it takes $1 out of some part of the industry's pocket, I would get barraged with 20, 30, 40, 50 letters. So would people in Congress. People in Congress would, then many of them would call me because they were getting campaign donations from some of those organizations. So it's, in some respects, we can do a little bit better, a little bit better, but until we reform how money flows into these candidates and into these races, and the fact that in most districts, the money to fund those races comes from outside of those districts, comes from corporate sources, comes from the campaign. It's going to be very, pardon me?
That's the corruption.
That's right. And that is, there's a straight line between that and what you have to pay every day for the things you talked about.
I would just add to that, you know, many of these things that you just discussed, the surprise billing, the transparency, you know, how much does this cost? One of the problems with the complexity of our healthcare industry is that, you know, pharma's gonna complain and blame the PBMs, you know, they're gonna blame the health insurance provider, and then the hospital's gonna blame everybody. And so there's a bit of a lack of accountability in a circular firing squad as to say, who are you gonna blame for the increased costs? But I will tell you this, healthcare is about to get accountability because they have proven that they are not able to regulate themselves. And when I talk about taking the market exclusivity period for brand name pharmaceutical drugs down, that's gonna be the accountability they're going to earn by having policies to increase prices in a way that just isn't fair to Americans. And so accountability is coming. I don't think they've proven that they can monitor. I think they have absolutely proven they are incapable of monitoring themselves. I'm not making any friends with brand name drug providers in Washington right now, and that's because it is completely inappropriate and dangerous what they're doing to American healthcare.
Thank you. If you will move on to the next question.
Hi, my name is Glenn Wolf. I live in Burnsville. My question is regarding the whether or not we can rely on a competitive marketplace in terms of, especially in terms of generics, to be able to provide for the needs of the patients at a reasonable price point not just prevent price gouging, but can we also rely on them to provide enough medicine, because there's chronic drug shortages across the country. And it seems like it should be a situation where the government should be dictating the drug companies how much they can charge, and making sure they have a minimum level of service, analogous to the Public Utilities Commission model, the PUC, where they don't negotiate or plead with the natural gas or electric companies to not the price gouge or provide enough electricity or gas. They dictate, they tell them they're going to charge this much, and you're going to provide this much service, and if you don't, then they'll be in trouble. That's what we need to do with the drug and medical device manufacturers.
Well, I'll just start by saying that, that's exactly what I'm trying to do, is to promote additional competition with generic providers. The facts are clear. In the first year that a generic drug comes on the market, the brand name drug falls in cost by about 50%. That's why brand name drug companies are working so hard to keep those generic products or biosimilars from a biologic perspective off the market. And right now, we allow brand name drug companies to pay generic providers in order to delay bringing them to market. And we, there are bills out there that I'm co-sponsoring that would end that practice, but you're exactly right. We have got to just take it head on and increase competition.
So, what you said is the exact right first step. We need more generics on the market. But you hit on some very important points. Even when once we have generics on the market, if they're not regulated and governed, we saw 2,500 generics raise their prices by more than 10% last year. We did see shortages. So I was asked to testify in front of the Institute of Medicine 2 months ago on how come lower income people aren't getting enough insulin. And you know what I said? I said, just nationalize insulin. The patent's available. Start making it. Start producing it ourselves. We can do that. And guess what? The minute the government announces they're going to do that, guess what's going to happen to the price of insulin? It'll magically start to come down. So I think the key thing that I think you were pointing to, regulated utility, and what you said, which is we have to stop being so nice with people who have had the opportunity to make healthcare more affordable for so long and haven't done it, I think is the voice that needs to be raised, quite frankly, in the support that Representative Craig needs behind her so that she can keep pushing as hard as she's pushing.
Can I just add? Yeah, thank you. I would just add, kind of echoing that sentiment, that healthcare, as Andy alluded to earlier, is not a traditional competitive marketplace. It's not a luxury commodity that it's not the newest iPhone. Most people who are seeking healthcare, who need the prescriptions, those generic prescriptions, to be at affordable prices and available on a daily basis, don't choose to need those prescriptions. They're not deciding, oh yeah, I really want to have diabetes today. And so I think that is such a key element as well, in that it can't function as a purely competitive market economy, because it's not the new iPhone. And I think that's a really important point to think of.
Let's go on to the next question. I want to make sure we get all the questions in.
Yep, and we're going to try and limit our responses to 1 or 2 people. So, thank you.
I'm not going to have a question. I'm Elise Luddy. I've worked 41 years as a professional nurse, both in service and education. And I think where we're going on the wrong path is calling this health care.
Yes.
We do not have health care. We have disease care. And thank God we have these two to do more than give out pills and talk about surgery. So my goal when I go see my physician, although I'm very sad that my physician looks only at my heart, and I'm more than a heart. So we need to have more and more physicians who look at the whole human being instead of just hearts. If I go to a physician, I don't want to even hear pharmaceuticals or surgery until they've talked about nutrition, exercise, and where is my stress level? And every one of us in this room should look at the mirror every morning and say, where is my exercise today? How is my nutrition? In fact, a lot of us don't know nutrition. And then where are my stressors for the day?
Thank you very much.
I just moved here from central Minnesota, Rick Nolan's 8th district, and so glad I'm in this sector. I know, but the guy that's there now, he is not helping us.
Thank you.
Oh, they're
Go
not
ahead.
answering her question?
She didn't have a question, she just made a
Well, I
comment.
have kind of a statement, then a quick question. The definition of insanity, everybody knows what it is. And if I'm fortunate enough to live one more month, I will be 64. And I'm so tired of the words consumers, access to health care. We don't have health care in this country, except for the military and Medicare. We have health insurance. And one example is the Washington Post just got some emails. They were allowed to get emails, and it was manufacturers talking to distributors of OxyContin and oxycodone. And this is, you think that's only them? It's CEOs of big insurance companies. We don't want insurance anymore. We want health care. And it's totally different in my opinion, and it's just, you know, what they compared the addiction to those drugs as the addiction to Doritos. And they made a lot of sly remarks about human
So
beings.
my question is,
So my question is, you know, how far is it to the left to want health care? And we can always have supplemental health care. And then also, can you explain the difference between the 35% administration cost for what we have now, as opposed to 3 or 4 if we were to have Medicare for all?
thank you.
Thank you. Yeah, and I think you speak for a lot of people. Now, the thing I would say is there's a series of decisions that you have to make. And I think the things that you said about insurance companies and pharmaceutical companies, I think most Americans would agree with. And I think most of the people who represent us, like Representative Craig, agree with. Real questions, though, also emerge around how much we're going to reimburse physicians, how much we're going to reimburse hospitals, and particularly in rural communities and outlying communities, whether we can reimburse them enough to stay open. So I think that as we get smarter and smarter about talking about what you said, which is let's make sure that every American can have access to the health care they need, that we start to talk about what some of the real issues are. And I think I'll just name a couple. One is let's talk about how do we pay physicians and hospitals for the care they provide? Do we make sure we're paying them for value? Do we make sure that we're paying them enough, but also enough that we save money? Because Medicare, if we paid everybody Medicare and Medicaid, we all know we wouldn't have enough physicians and hospitals. That's one question. The second is, what should be the amount of money the patient themselves should have to pay? Is it zero? Is it a $20,000 deductible? Is it somewhere in between? And that's a question. Third is around people who have employer-based insurance. If they want to keep it, should they keep it? If they don't, should they not? What about all the new young people today who most jobs don't come with insurance? That's their reality. And then finally, your question around administrative costs. We now have more people working in healthcare that don't go anywhere near a patient than we do people who actually go touch patients every day. So she can do the best job possible. But she's carrying around a whole bunch of other people that are sending her notes, sending her emails, asking her to send stuff back to her. And so a lot of the cost that she provides comes from there. So we got to get serious about those 4 questions, in my opinion.
Absolutely. Look, there's absolutely no doubt that we have to lower the cost of healthcare in this country. And the question is, how do we go at that, and how do we deliver healthcare for all Americans? The woman, the nurse who just made the comment, she isn't reimbursable for about half of the things today that we just said we need to start looking at in order to have a prevention culture in this country. So I'm gonna tell you, until we look at the way we pay for healthcare, a volume-based healthcare system, it is going to be very difficult to change behavior in the healthcare system. And so the question is, how do we move forward next? And I know a number of folks in this room want to go faster than this, but I think the first step, and this is why I have co-sponsored and am promoting the co-sponsorship of the Medicare X Act of 2019, is because it would be a true public option to compete with large health insurance companies in this country. And the reason I like Medicare X is because it would start in the rural areas, number one. Number two, it gives Medicare the explicit ability to negotiate drug pricing, just like we already do with the VA. That to me is just good common sense. And the third reason I like this bill is because it gives the Secretary the authority to raise reimbursement rates for Medicare. Because as Andy said, and many of you know, current Medicare reimbursement rates will not allow these rural hospitals to continue to operate. And so I think we have to recognize that there's no one solution, that this is going to take a number of various initiatives to accomplish, and that's what we're all after, making sure when someone gets sick, they've got the health care that they need and deserve. Let's go to the next question.
Hi, thank you for being here today. My name is Kaylee Lavelle and I live in Lakeville. I'll try to make it brief because there's a lot of people standing behind me. I do have a chronic illness, and unfortunately it's a few rare incurable diseases, all of them involving extreme intractable pain, which is incurable pain. And the worst of it is reflex sympathetic dystrophy, and it's ranked higher than cancer pain on the McGill Pain Index. I do watch my nutrition, I watch my diet, I try to exercise. Long story short, what is happening throughout our country and the Minnesota is legislators and are dictating my care. My last resort medication is unfortunately opioid medication, because even based on what the Mayo is telling me, there's nothing left for me, and my insurance company fails to pay for IVIG at $7,200 per infusion. So I'm being forced tapered. I'm on palliative care. The only reason I'm standing here right now today is because I was bedbound all day in order to get here today. I put on a little makeup, so unfortunately I do get judged if I don't wear makeup. So what I'm asking you is in regards to this opioid crisis, opioid epidemic, looking at it as a whole, how are you going to address the people who do have a medical necessity for these medications, not by choice, but by circumstance, and stop cancer patients from being denied palliative care, from being forced tapered?
Thank you.
Thank you so much. I first of all just want to say thank you for being here. Thank you for being here and advocating for yourself and for patients all over this country. I do think that we have to be very thoughtful about the actions we take with respect to legislating care. We all know, though, that on the other side of that there have been physicians, there have been dentists who have overprescribed. But we need to make sure that we don't catch folks like yourself or veterans or those who are struggling with chronic pain, and absolutely eliminate the possibility of an opioid. So it's a tough issue, because at the end of the day, it's challenging because we know that prescribing patterns have been problematic, but we want to make sure that we understand the unintended consequences of the legislation that we promote. So thank you for being here. You're very brave.
Thank you. Anyone else?
Yes, thank you again for the question. I think I definitely agree that having legislation or cost dictate the care that occurs in an office between a physician-patient relationship is very complex, because if I, in my medical training, have been taught and understand how to best treat a condition, and then I'm told by law or by cost limitations of medication that those things that I know are best for the patient are not possible or not legal or unavailable, then it's very frustrating for both myself and my patients. And so I think that being aware of how all legislation impacts that doctor-patient relationship is very important. And I appreciate programs like the bill that was passed in Minnesota to increase physician education and availability of education around issues like opioid prescribing in medical schools and in continuing education for physicians and other providers, so that we make sure it's healthy and safe for everyone.
Thank you.
And just one final comment. I would exempt palliative care.
It is exempt, except I'm still being forced tapered in the state of Minnesota.
Well, we should have you in touch with my district office and team to see if there's anything we can do to be helpful.
Thank you.
Hi, I'm Kathy LaBelle. Yes, Tammy is my sister-in-law. And I want to highly, highly, highly encourage that we start looking at getting more support across the board for family caregivers. Even when they go into assisted living or memory care, which was just licensed in the last 8 weeks here in the state of Minnesota, from newborns to our elderly, we have to support our family caregivers. They are the cheapest caregivers out there, but they need the support throughout medical care, and including adaptive housing to make sure that those that are staying in the house, that are safe, and across the board. And even when they go into a facility, that they have the support there, because there isn't always the support of family caregivers when the ultimate last resort is placing them in somebody else's care, because that care may not be there. Thank you.
Thank you.
Thank you so much.
Next question.
Hello, my name is Jean Foreman. I'm a constituent from Burnsville, Minnesota. I'm a registered nurse and a member of Minnesota Nurses Association. I have a question today regarding recent developments for a business that is located here in the 2nd District, Blue Cross Blue Shield, and the recent news stories about their partnership with a for-profit company, I believe out of South Carolina, and their changing of rules for reimbursement, for pre-authorization, and other restrictions on folks that already have healthcare insurance, so that hospitals are not able to be reimbursed properly. They're finding out afterwards. And excuse me, it's one place where I think trickle-down economics is now working in reverse, where now those costs that were maybe previously covered under insurance are being passed to hospitals, who are then passing it down to patients. And also, when hospitals are trying to cut costs, they're cutting costs at the bedside. And so this is very concerning for myself as a nurse and my patients that I care for. I'd like to comment.
You know, I would just acknowledge that I've read about this in the last couple of days, and I plan to reach out to Blue Cross Blue Shield personally on the issue. And you know, staffing levels at the bedside in hospitals around this country are leaving our nurses unsafe, and our patients not as well cared for as they could be. So we have an absolute commitment to reach out to Blue Cross.
Thank you, Angie. Appreciate you.
Go to our next question.
Hi, I'm Marcus from West St. Paul, and as you might be able to tell from my accent, I'm not from around here. I'm an immigrant from Switzerland. Switzerland has universal health care, and I think the U.S. system should try to copy more of what other countries have already done. So in other countries, they pay their doctors even if they have universal health care. Now, in Switzerland, they introduced something like Obamacare, what he wanted to introduce before he was castrated by the GOP Senate. And it is still, because it is market-based, it is just close second. It is maybe 25–30% cheaper than here. But the real cost savings are happening when you can cut out all the administration, when people go to the doctor and then they have to show the administration and then call somebody, is that covered, is that not covered? Back and forth. So, my question now is, what would be a negative point from your view to have something like Medicare for all?
Thank you for being here. This is a conversation Marcus and I have been having for 4 years.
Yeah.
Look, Medicare is a fee-for-service system. Medicare itself is a fee-for-service system. So what I would say to you is when I say I like to look at how we pay for healthcare, that is one of the changes that I believe we need to have in the Medicare system as well. It is still a fee-for-service system. The healthcare providers still make decisions based on volume. But you said something really important when you said Switzerland, when you think about the German system or the French system, where they have been able to, and I actually think the U.S. system would be easier to transition to universal health care into a system like the German system, which has only for-profit health insurers, not-for-profit health insurers, where employers still can come in and purchase the health insurance marketplace for their employees, so it doesn't do away with that completely, but it's in a not-for-profit health insurance system. And for citizens who don't have employer-sponsored health care, there's a basic level of health care provided to every single person in that system. I think we should look at a number of systems around the world and figure out what is the fastest way we can morph the U.S. system into one where every single American has access to a basic level of health care. Couldn't agree with you more. And I'm going to ask Randy to comment on this too, because I know it's an area that he's worked within, and having run the Medicare and Medicaid, being acting secretary, I think has some really great insight.
Thank you. A system that I think is a very interesting one is the system that's in Australia, which is not that different than the one in Germany or the one in Switzerland. And I like talking about Australia because we talk about Europe, Americans kind of recoil, but we like the Australians are swashbuckling frontiers people. and so we kind of like them. And yet the former Prime Minister of Australia, I was having a conversation with him, and he said, we love America. We think we have a lot in common. But there's one thing about you we don't understand. And I said, what's that? He said, and I'll never forget these words as long as I live. He said, you seem to like to leave your citizens in a state of quiet desperation. And he said, we don't understand that. He said, we don't do everything in Australia. But we try to take the basics off the table. The basic worries. So, yes, possibly there's a system, the Australian system, everybody couldn't go to Mayo Clinic every time they wanted for everything they wanted. But people don't have to worry that if something happens that they can't pay for, they're not going to go bankrupt. If they want to take their kid to the doctor, they can do it. If they want their kid to play on the soccer team, they don't have to live in fear that a twisted ankle is going to send them into bankruptcy. And that's a decision that we can make as a country. And there's lots of different paths beyond that. But that fundamental step, which separates us from many other countries in the world, in fact, not just developed countries, many other undeveloped countries in the world, is something we have to get serious about changing fast.
Okay, I'm going to switch it up on you panelists, so you might want to get your pen ready. We're going to have the last three all ask their questions, and then we'll let the panelists respond to all three questions to try and save some time.
All right, my question is actually a little bit related to the last one here. So I think a lot of people in this room probably may support a Medicare for all system eventually, but I think you would all agree that that's not really something that we can achieve right away, given how much our country relies on the healthcare industry as part of our economy, given the percentage of the GDP it is. So I'm curious to hear, and from you work in the healthcare industry as well, what do you think are some maybe middle steps that we can take to transition to a Medicare for all system before obviously overhauling the whole system? And do you think it's plausible to have a mixture of public and private healthcare options that will work in this country?
Thank you.
Okay, I'm Diane from Lakeville,
And my son passed away 2 years ago at 17 years old, and he had, you know, a heart condition we didn't know about. And so I'm seeing around the country, you know, different states setting up bills for it and passing it, and I'm talking to the senators and the House of Reps here also, and I'm hoping maybe by the spring, maybe something will fall through. But, I mean, what is needed is EKG and echocardiogram. And, you know, for even, you know, and it's a lot of kids that are in sports that it happens to, but it's not all. So I feel like if it, you know, could be a athletic thing that you haven't checked for their hearts, you know, and it, I mean, there's so much news on Twitter and, you know, just of different people dying, and so I just, you know, I would like to see it. I'm really working on it for Minnesota, but I mean, that's not it. I mean, it's like the whole United States needs to, for so many kids, and losing kids, hard.
Thank you.
Every kid died. Oh.
I just want everybody here to know how loved Joey was in Lakeville and just how amazing a young man he was, and how proud I am of Diane for fighting on his behalf. So could we give Diane a round of applause?
It's hard to follow that. So, my name is Laura Morton, and I live in West St. Paul, and I've been a physical therapist for about 12 years, so I am intimately familiar with a lot of things that people are talking about. And from a personal standpoint, I'm getting close to the Medicare age, and so I think one thing none of us are talking about is the realistic ability to make any changes. You know, when the ACA passed 10 years ago, it seems like a public option at that time would have been the thing to do, because now I don't see the political possibility of getting anything through Congress, partly because of the corruption that's been talked about. And so I guess mainly my question goes to Andy, since you, I believe, worked on the ACA as well as CMS, and you talked about the Medicare Advantage losing 25 billion of profit going to that. Congress just passed the repeal of the Cadillac tax, which is another 200 billion that we're losing. And the same thing happened with the medical device tax, which I believe, you know, you worked on repealing. So the biggest problem is the corruption and the fact that the current administration does not have any intention of faithfully executing the laws of the nation, which include the ACA. So
Thank you.
Or try to impeach the current administration.
My question is?
The question is, what is realistically able to be done? Because I don't see anything.
Thank you.
The second point I was going to make is that I think ranked choice voting is the thing that I'm working on most at this point, because the political parties, I'm afraid, are just a part of the problem, not part of the solution.
Thank you.
So maybe we can start with Dr. Cross, move our way back to me, and those three questions, any comments you have on any of the three, and then any final remarks you have, and then we'll close it out.
So I think I'll start with the first question regards to the healthcare economy being such a large portion of our GDP, and trying to think about kind of what's realistic in terms of public and private mixed payment that it does raise a lot of concern about how can we coordinate things best, how can we have the, as I mentioned before, healthcare is not a pure choice market economy, and so how can we make sure that everything is available and covered that is necessary for all of our patients. But I do think that a healthy level of competition is helpful, and I agree that having a public option would help to kind of set a benchmark for some of the private insurance companies. And there can be a mix, as there are in some other countries, even with universal health care. And so I think that I do see that as feasible. I don't know if it's necessarily the best option, but I think that would be at least a direction we could move. And then I just also want to really thank Diane for bringing up her son and the struggle that he faced. And I think that speaks so highly to the importance of everyone having a primary care doctor and having the preventative services that they need to stay healthy and to look for things that may be undiagnosed or may need specific treatment so that we can get those things in place as soon as possible. And I really believe that everybody in this room and everybody in this country deserves to have a primary care physician who is able to be their partner in their health. And so I would really love to see that for everyone. Yeah, thanks.
Thank you. So I think the first question was excellent. Where do we stand between where we are now and a possible Medicare for all option, and where do we see things realistically in the next couple of years, which then ties to the last question about the current political environment and what we can or can't actually accomplish. I share Lauren's perspective about the public-private hybrid and the possibilities that there are several European countries that have that, and I think it's a promising step forward. I do, comes up in my classroom a lot. We talk a lot about what that means in terms of possibly segmenting the market and the most vulnerable people and what type of health care they get when you still have the ability to pay for more, pay for better, and that's not available to everyone. And so the thought exercise we use a lot in the classroom to kind of think through that. And I'm not entirely sure what the answer is, but I think that there's opportunity to think in that space and think about how we can move forward there. I think, again, though, I'm going to punt to the other side of the table about what can be done in the current political environment, because thinking back to when the ACA passed, it felt like there was, it felt like such a golden opportunity, and the ACA got cut down a lot from its original form, as we know, and so things today feel very different, and I'm not sure. So I'm going to punt to the other side.
So people tell you the politics of healthcare are hard. They're right, it's not very hard. If people tell you we can't pay for what we want as a country, that's just not frankly true. It's just not true. We just added $2 trillion to our debt in order to reduce the corporate tax rate from 35% to 21%. Anybody here like better because we've reduced the corporate tax rate from 35% to 21%?
No.
So we can afford to do that. We can afford to do what's right for the American public. I'll give you just a quick sense of how not difficult it is to pay for some of the things we want. There's a bill that your colleague, Congressman Underwood, has sponsored. The effect of that bill would be to cut premiums by 50% and increase 3 million more, increase coverage for 3 million more Americans, and a bunch of other really nice things. It's a very smart bill, and the cost of that bill would be to take the corporate tax rate up from 21% to 23%. We could cut premiums in half in this country for effectively that equivalent. So we have the ability to do that if we send people to Washington and prioritize the way we want to prioritize. And I will tell you, it will sound like a very Pollyannish solution to all of this, but there is one way that it happens. I will go back to the very moving life story that Diane, you shared with everybody, which is that it is when all of us, Diane and all of you, are more powerful than the special interests. That's when it will happen, and it won't happen until then. Because your stories, sharing your stories, as brave as they are, as hard as they are, guess what? All of us are going to become, if we're lucky enough, we're all going to become caregivers someday. And all of us, whether we're lucky or not, are going to become sick someday. And then we're going to understand what people are talking about. That's just the way that the human body works. The country hasn't caught up to this because there's too much money at stake. That's my bell. I want to thank you all. Please support this congressperson in making sure that she gets things done for you.
I'm going to respond to the last three questions, but then I'll make some concluding remarks for you as well. So the question about what do we do next? What are the middle steps? Don't forget that we have to remember the first step is to protect pre-existing conditions, to make sure that we can keep our kids on our plans until they're age 26. We have to stabilize the healthcare system we have today if we want to transition it, because there are some great bills out there. I'm on Representative Underwood's bill. I'm the author of H.R. 1425, which is an effort that would reduce premiums in the individual marketplace. And look, if you buy your health insurance through the individual marketplace today, and you're paying the enormous premiums with those high deductibles, of course you think the ACA is terrible. And so we need to recognize that there are some things that have to be improved in the ACA. That this is not the ACA anymore. It's today's healthcare system, and the question is it working for any of us? And is it working for all of us? So that's number one to do, is stabilize the healthcare system we have today. And number two is, for those of you who support expanding Medicare, let's let people buy into Medicare and get some experience with being inside that marketplace. Let's let neighbor talk to neighbor at that point. That's what the Medicare X Act of 2019 is designed to do. Diane, your story, and Joey, is the advocacy work that you have done, the work that you've done to make sure that there are people at the state capitol and elsewhere who are working to make sure that every young person gets a screening, whether they're in sports or not, whether it's an echo, whether it's an EKG, whether it's universal access to insulin. All of these issues are incredibly important, and we have to continue to move in that direction. And then my final comments really are around the fact that what's been extraordinary here today, and thank you for coming here today and being part of this little bit of a new format for us for part of this town hall, is that I had no idea what side of the aisle or what political spectrum you lean to. We just had one of the most thorough discussions of healthcare policy in a town hall setting that I have been part of since I have become a member of Congress. Because at the end of the day, when your family gets sick, no one cares what party they belong to. No one cares what their political persuasion is. The only thing you care about is getting your family healthy again. And I'm at that age where it almost seems like every week one of my friends calls and says, my husband's suffering from cancer, my wife has breast cancer. I'm at that age where it's starting to happen to me. And we have to be willing, we have to be courageous to say, I don't care what party and what platform this is coming from. If this is the right way to stabilize the healthcare system in this country and move to make sure that every single American has the healthcare they need when they need it, and that we have a healthcare system that is more focused on preventing disease and treating disease, then we will have us in this nation. So again, panelists, thank you. All right, we're going to transition real quick, and I tell you, I'm going to do a huge lightning round of questions. If anyone has a question not related to healthcare, Kate, you're going to lead that portion as well, and we're just going to line up at the mic again, and I'm going to try to keep my comments pretty short. Kate, was your mic on? Oh, it is. Cool. All right.
Representative Craig, first of all, I want to thank you for your support on improving the HOPE Act and the Younger Onset Alzheimer's Act. That's very important to me as an individual. And then also, I want to ask you if you can, what you can do to help secure an additional $350 million for Alzheimer's disease research at the NIH.
Well, thank you so much. We just, first of all, thank you. I've had the opportunity to sit down with you a couple of times, and this is one of the best advocates for cancer research in the country standing in this room today. So thank you so very much. I just visited the NIH last Monday, and it was an extraordinary experience, and I asked the question, you know, what could you do with more money with respect to cancer research and Alzheimer's research in this country. These were the two areas that I specifically asked about, as well as the question around how do we make sure that we have preventive education and medicine in this country again. So we just secured the largest increase to the NIH budget out of the U.S. House Appropriations process here 2 weeks ago. So I will continue to advocate, obviously, for early onset research. Thank you.
Hi, Minnesota moved to amend volunteers would like to express their appreciation for your co-sponsorship of H.R. Resolution 48, the bill in the House of Representatives, the We the People Amendment, and H.R. 1, the For the People Act, both of which combined together will make it much easier to pass many reforms such as Medicare X or Medicare for All, and not have them challenged in the courts. Because H.R. 48 says companies are not people, and they do not have human rights as in our Constitution. And H.R. 1 is a bill that champions campaign finance reform, ethics in government reform, and voting rights. So when you combine those two bills, you wind up making it much easier to pass any kind of legislation without having it challenged and nibbled away by the courts. Thank you.
Thank you. Thank you. And you're welcome. I'll say just a little bit more, but not much. Look, Citizens United was one of the worst Supreme Court rulings in the history of our nation, and it is leading to a special interest bonanza in Washington. I'll just add that I am still amazed sometimes when members of Congress are back lobbying other members of Congress, and I have introduced a bill called the Humble Act that would ban for life any member of Congress lobbying their colleagues once they leave. I also don't think we should hold individual stocks. I think that should be illegal, and I have personally pledged not to do that, nor would I ever become a lobbyist for my time serving you. So thank you for that. And you're going to see another record super PAC spend here in the 2020 election. All get ready for it, because as long as Citizens United is the law, H.R. 1 tackles some of that, but as long as the Supreme Court has judged Citizens United to be the law, then it's going to be tough to overcome the super PAC spending.
I am Don. I'm a recent immigrant from California. And I never saw anything like this in my district when I lived back there, so I really appreciate you doing this. I really feel like
Thank you.
I have a lot of frustration with how the government is working these days. As I sat here, I think my biggest frustration is that there just seems to be way too much power concentrated in the President and the Senate. It's like the Senate has become a place where all good ideas go to die. And because he's not from here, I don't really feel like there's anything I can do about it. What I'm wondering is there anything that the House is doing right now that would require the Senate to take up bills for discussion and consideration that come out of the House?
Well, thank you for being here, number one, and welcome to Minnesota. Have you survived one winter here yet? Okay, all right, you're gonna last then, okay. Look, I don't know of any specific conversations around sort of procedurally, but I will tell you that, you know, what I hope the American people see is that the United States House of Representatives is passing a number of very, very good bills right now. And you're right, they're going to the graveyard over in the Senate because Mitch McConnell will not bring them forward. H.R. 1 is a terribly good bill. It's a terribly good bill that promotes democracy, that promotes campaign finance reform. When I talk to my colleagues across the aisle, they are as sick of these, you know, hateful super PAC spending where neither side knows where the money's coming from and who's running ads against you. We're all sick of it. So, you know, I hope that the American people continue to call Mitch McConnell and encourage him to bring forward a number of the good bills that we've pressed forward with. And, you know, let's have a vote on them. If the Senate votes them down, fine, but there's some really good, particularly around stabilizing the current healthcare system that we have today that have passed the U.S. House. So thank you.
Next question.
Hi, I'm Philip Parrish, and I'm a 21-year veteran in the United States Navy Intelligence. I specialize in counterterrorism and foreign policy. I'm here today because I don't care about politics, I don't care about the parties, I really don't care about anything but my communities and my family. I've spent the last 21 years witnessing a level of fraud and exploitation of our citizens that I can no longer stand silent about. I appreciate the opportunity to visit with you now. I'm asking you if you are willing to use your access to uncover and unmask the names that you can unmask privately of associates inside Minnesota, not your associates. U.S. Person 1, U.S. Person 2, Minnesota Business 1, Minnesota Business 2. Unmask those, and please, I'm asking you, I'm begging you to legitimately, effectively investigate those people and institutions, and I'm asking you if you are willing to start fighting for us and to reduce the exploitation of our citizens and hardworking taxpayers, please.
Thank you. Thank you so much for being here. I'm going to ask my district director, Nick Coe, to follow up with you because I sincerely want to understand more about what you're talking about. And thank you for your service to this country. Thank you for everything that you have done. And so let's put my office in touch with you and see what specifically I need to be asking for that I haven't yet. So we'll be in touch. Where's Nick, by the way? Hey, Nick, raise your hand. Great, good.
Hi, my family runs a farm in not too far from here, southern Minnesota, and been in our family about 150 years. My question is, and I'll get some background here, but my question is, can Congress override the tariffs that one person has put in place that's having so much impact on our farmers? And it may seem counter to what people might expect me to say, but my family is very troubled by the $28 billion over these 2 years, $28 billion of the fees that has been approved as payouts to farmers, and that's an exact, payout because of the damage they're incurring from these tariffs. And that money is never been approved by Congress, as far as I can tell. It's not. It's been approved by one person, the Secretary of Agriculture. So it's money that's coming from from the additional costs all consumers are paying because of these tariffs. And I don't even think that's actually paying for the $28 billion. I think it's just coming from taxpayers. And so it seems like it is, I don't know, I honestly don't know if Congress can take action to, or the Senate together take action to override these tariffs that are having such a great impact on farmers and also costing taxpayers.
Well, first of all, thank you for being here. 95% of the almost 4,400 farms in this congressional district are family farms. So when you think about corporate farms, these are family farms in the 2nd Congressional District of Minnesota. Look, I think that I said before in these town halls, I wake up every single day looking for something the president is saying or doing to agree with. And I do agree that China has been a serious offender, and that the problem is, I think the reckless trade war that we found ourselves engaged in does not have a strategy or even an exit strategy. So I just had soybean farmers in my office this week in Washington talking about the 60% of the market that is exported, and whether now that China has gone to Brazil and other nations to source their beans, whether this is coming back ever. So your question is more about oversight of the administration and how do we make sure, but at the end of the day, we need a willing Senate to work with us on some of these things. And our farmers that I talk to want two things. They want access to markets, and they want a fair price. Those are the two things that they want. And they want some predictability in the marketplace. And so do companies, right? So do the companies who are being affected by the what I believe is a reckless trade war that we found ourselves in. So I'm fighting every single day to ask the administration to do a number of things. One is, let's end the reckless trade war. Let's move to put together a trade agreement with Mexico and Canada that is better than NAFTA, but has enforcement mechanisms with Mexico in particular. There's another problem with that trade agreement around biologics that would take me another 10 minutes of healthcare to get into. But at the end of the day, we need to look for access to markets for our farmers, not trade assistance. And we need to stop causing ourselves more problems by just tweeting the news of the day and affecting our farmers. Thank you. I was trying so hard to go 1 minute.
Hi, my name is Glenn Wallace. I live in Burnsville. And my question is there ever been any efforts or do you support or repeal the Taft-Hartley Act, which is a union weakening act that, among other things, allows states to pass right to work for less as a union freeloader laws, and along with a whole number of other union weakening facets to it. It seems like the Minnesota DFL, the L stands for labor. It seems like somebody would lift a finger to repeal the Taft-Hartley Act, given all it has done to weaken the labor movement in this country, even though it was passed way back in 1947.
It was Glenn?
Glenn.
Glenn. Thank you for being here, Glenn. And I support amending Taft-Hartley to eliminate any possibility of right-to-work laws around this country. Period, full stop. Period, full stop. It's one of the reasons that wages have declined over the country in the last little bit. You weaken these right to organize and collectively bargain in states, and it's a reason why Minnesota's lost some manufacturing and jobs, because companies will take them to a right-to-work state. I call it a right-to-work for less state because, right-to-work sounds so nice, but it's really right-to-work for less. But thank you so much for being here. Well, with that, oh my goodness, we made it through all of the questions. And again, I just want to end by saying thank you so much for being here, for being part of really participative democracy. Many of you, I know, call my office from time to time or write to me from time to time, and I appreciate your input. I am listening. It helps me. When I go back to Washington, look for opportunities to find common ground. I just want to end with a little bit of that common ground that we've been able to find over the last couple of weeks. Believe it or not, if you listen to the news, you would think that there was absolutely nothing for me to talk about with respect to common ground, but I am incredibly proud to tell you that the appropriations we passed for special education funding, IDEA, contained the largest increase in a decade. And I want to give a shout out to my colleague, we may not agree on everything, Pete Stauber from the 8th Congressional District, because Pete and I have been working together in the Congress to sign up co-sponsors for the IDEA Full Funding Act. And over the course of the last several weeks, we added 14 more members of Congress to that bill. So I just want to end on the note that there are lots of things in this country that I know from a policy perspective we're far apart on. My hope is that we remember that we're all neighbors, that at the end of the day we have more in common than we have that set us apart, and that we look to that common ground and just remember that. So thank you so much for being here, and I really appreciate your input. Thank you.